You are watching the Jennylyn Show, and I'm Jennylyn, Gleave, your host. And today, we are Dr. Stuart Melnick's office in Los Gatos, California. We are at the Los Gatos Laser Center, and we're doing this segment for those of you who are unhappy with different parts of your body. Things you want reduced, things you want enhanced. This is the place for you. And so I'm going to start off with Glori, who's the magician here. Hi, Glori.
Hi, pleased to meet you.
Thank you so much for allowing the Jennylyn Show to come in here and share with my viewers the ways they can change the parts of themselves that they don't like. There's so many people who want to add, reduce, enhance. Tell us how you play a part in all of this.
Well, I'm officially a face mapper for the doctor. Dr. Melnick actually does all the beautiful work. And I get to see the patient and go over their concerns, like my face is dropping, I'd like my face to look more lifted, or this line bothers me. How do we take care of it? Well, I'm the one that plays the role in how do we fix it? Well, we don't just fill in a line, we lift the face. We go ahead and put the fillers in the areas that are going to make the patient look younger and fresh, not done, like nothing got done.
Awesome.
Just better.
So this is non-surgical we're talking about. So tell us how you do this.
We use a permanent filler called Artefill, and it lasts 10 to 15 years. And the key is to place it in the right areas where it's going to lift the face and make the face just look refreshed.
That is great. Is this something new?
It's been in Europe 30 years. Of course, we always take longer to get it in the United
States.
It's been about 9 years here in the United States. And Dr. Melnick has been using it for about 5 years. And he's a master injector. You have to be really, really good to work with permanent fillers. And he is.
Well, I chose this clinic because I heard he's the magician.
He is.
That when he injects, he doesn't cause any pain. And he puts it in the places where it needs to go, so you don't look like you've done something.
Oh, yes.
And we've seen so many people, especially in Hollywood, who've had enhancements, and it's so obvious.
Yes. So the key is to do the work, turn the clock back with no telltale signs.
Okay, so the Artifill.
Yes.
How often do you inject it? How long does it last? Tell us more about it.
Artifill is made of PMMA molecules suspended in collagen, and every syringe is a 0.8. Starts lifting the minute it's injected, or it starts correcting the minute it's injected. You don't have to wait to look good. You look good immediately. Now, the beauty about this product that it keeps getting better with time. So say you look good, you got injected today, a year later you even look more fabulous.
That is so awesome. So how does it compare to other products? I've heard, I know because I ran a cosmetic clinic at one time, but they have other products like Restylane and Radius. How does this compare to those products?
Well, Restylane, Juvederm, Radius, Sculptra, they're all very good products. The problem is they don't last long enough. And so you get a group of patients that are suffering from what's called filler fatigue. They don't want to keep refilling.
Right.
Every 3 months or every 6 months. With Artifill, you correct an area, you're done. And then say you will come back a few years later and you notice that you could use a little bit more enhancing somewhere else or a little more lifting. You don't have to start from the beginning.
Because of my knowledge of this industry, I know that our collagen slows down when we get to a certain age.
Yes.
And that causes the drooping, and we lose our glow.
Yes.
I read somewhere that Artefill works with your collagen. Tell us about this.
Yes. Well, first of all, let me backtrack a little bit. We lose a teaspoon of bone, muscle, and fat a year starting at the age of 25. So there's a lot of collagen that needs to be made up for the loss of bone, muscle, and fat. So the beauty about Artefill, it stimulates your own collagen production. The PMMA molecules are continually stimulating your own collagen. That's why you look naturally good.
That is great.
Now, for how long? 10 to 15 years.
What will determine the lifespan of the product?
I think also life, the way you live your life. I mean, if you smoke a lot, drink a lot, and you compromise your health, your ability to produce collagen is not as good as maybe someone that lives a healthy life. But that's not a problem because the product's going to keep working regardless.
So is this the only product that you work with, or do you work with the other products?
Work the other products, but it seems like anybody over the age of 40, they just want permanent. They don't want to be wasting their time with temporary injections that are just leaving them empty. Because here's the other problem. Every time you do temporary fillers, you're inflating and deflating the same area over and over again, like a deflated balloon.
Okay.
With Artifill, you're filling it once. You're done.
So if you're someone who's using Artifill around your eyes, do you still need Botox?
Yes, because Botox does one thing, Artifill does another. Botox reduces a muscle activity where Artifill corrects a volume deficiency. So you need both.
Okay, so if someone comes into you and they're unhappy with all of this and stuffed around here, what are some of the areas that you can put this product?
Well, all those areas that you mentioned, but we always start at the top. Lifting starts at the top. The telltale signs of a person that is older and it's not 35 anymore is that they have a recessed area called the temple region, but we call it the peanut head. And it's really indented. That means
like mine.
No, you look amazing.
Thank you.
So that area is the culprit for the face to be lifted. So if that area is recessed, you could pretty much tell the face is dropped forward because there's no support back here. So that would be one of the first areas we fill, is the temple area, to start lifting the face up and providing support.
How often do they have to come in for you to administer these treatments? Or can you just look at them today and say, you'll need 2 syringes and send home a happy patient?
It all depends on their budget and their social calendar. Say, for instance, we can do as much as a patient can do in one sitting. We've done up to 18 syringes in one sitting, and the patient looks amazing, leaves, and they're happy. But say the budget allows only 3 or 4. They're not wasting any of their money, so it doesn't matter. They can come back. If their total plan is 18 syringes, they could do little at a time. If their total plan is 5 syringes, it doesn't matter. They can just do whatever their budget allows because it's not going anywhere.
18 syringes? You've actually had someone?
Yes, and I'll show you some examples of 18 syringes.
Oh my goodness, I cannot wait to see it.
Yeah, it looks totally transformed, beautiful people, and they just actually look refreshed. That's about all.
So a patient comes in here and they say, oh, I'm unhappy with my face, I don't like how this is looking, this needs coming up like mine.
Yes.
Or this needs this, or, you know, and so you take a look at their face, and then what happens? You look at their face, and then...
And then we start marking the areas that need improvement, that we can help the patient with.
Okay.
Some things are textural, like the patient says, I have 20 little lines everywhere. Well, that wouldn't be an Artifill issue.
Okay.
That would be a laser issue.
Okay.
Or the movement would not be an Artifill issue, would be a Botox or Dysport or Xeomin issue.
Okay.
So we start by mapping the face and looking at the areas that only need improvement. We don't need to do the whole face, just the key areas that hold the face up.
Okay, so Glori, tell me, beside Dysport, tell us about Dysport and some of the other products.
Well, Dysport, I think Dr. Melnick says is best, is another neurotoxin like Botox, Dysport, Xeomin. We call it Coke or Pepsi.
Okay.
They all do the same job.
Okay.
But some patients do better with one or the other.
Okay.
Depends on their tolerability. Some patients can tolerate Botox better than Xeomin, and vice versa. Some tend to take effect quicker. Xeomin to me is quicker acting, where Botox takes good 14 days, 10 to 14 days.
Got you. So it's just like Botox, but it just depends on...
Just another name brand.
Okay. And Restylane and Radius, do you guys administer those products?
Absolutely,
well?
and they're wonderful products. Like I said, the only problem has been that they don't last long enough.
Okay.
And with Artifill, patients are so happy. We have happy patients.
I could tell. I see them coming and going. Maybe
happy.
I can be one day soon.
So,
hey, we are joined by this very handsome young man here. And this is Dr. Stuart Melnick. Dr. Melnick, thank you so much for being a part of this.
Good. Thank you very much for coming.
Sure. I can't wait to share with my friends how they can all become the beautiful or more beautiful people than they already are.
Well, Glori Love was my face mapper. I think has summarized things very, very well. I could further add that the reason why Artefill has become so popular is that patients do not want to be operated on with facelifts
Right.
anymore because of the pain, the downtime, and other medical issues involved. Now, Artefill will last as long, in my opinion, as a surgical facelift. So it's a great answer to surgery.
So you and Glori are a partner.
Yeah, she maps the face. She has a wonderful eye for where the volume loss has taken place. Then we map the face out, and then I inject the Artefill. We use some local anesthesia, and also Artefill has a local anesthetic agent in it, so it's not as painful as having surgery.
Uh-huh. So how long is the downtime when someone, after someone has had this administered? Is the face swollen? Is it red? Is it turned black and blue? What are some of the side effects?
Well, some patients are what we call swellers, and so we use special drugs or agents to reduce swelling. Other patients don't swell at all, and it's very dependent on what area of the face we actually do.
Okay.
And if I may add, if they're not swellers, they're usually bruisers.
Okay.
So you get one or the other.
Okay.
Now, the one thing I have to say about this product, it swells less than the hyaluronics, which is the Restylane and Radius and all those. And not only does it swell less, you bruise less with it because it's not acidic.
Got
So
you.
you will have the trauma of the needle to contend with, and that also always is a histamine response, and your body tends to bring a little fluid in that area. But in a couple of days, that's pretty much resolved.
And there's no evidence when you've done this that you have.
No.
Nobody can look at you and go,
That's why Dr. Melnick is good.
Well,
what happened to your face?
Glori makes a good point because the hyaluronic acids, when we inject them, stimulate water entering the area. So you get a lot of swelling and filling. So patients may look good for a couple of days, then the water leaves, and it's not as full as it was. That does not occur when we use
Kind of
Artefill.
like a false positive. So they think they're filled and they look amazing,
Right.
but 2 weeks later, when that fluid comes down, they're going, "What happened?"
Uh-huh.
With Artifill, it's you see what you get. It's right there and then.
Does
It's
the product
correction.
move around? Because I know when I worked in this industry, we had situations where we injected patients and the product wound up somewhere else.
In this case, it does not.
It does not,
You
no.
would have to be, the product would have to be smaller than a human cell to be able to be absorbed and moved to other parts of the body. It's not. It's larger. It stays put, it behaves. So wherever doctor says it's going, it's going to stay
And the
there.
other thing with Artefill, as Glori said, if you may need 10 syringes or 18 syringes and you only do 5, if you come back in several weeks, when we add more, you haven't lost the first injections. We're only adding to them.
Uh-huh.
Whereas with the hyaluronic acids, you've actually lost them by the time
Right.
you come back for more.
Right, exactly.
And patients get needle phobia. They're not happy with coming back every 6 or 8 months and being repoked with needles. This way, with Artefill, you do it, and it may last for years and years, and you're done with it.
Cost-wise,
Amazing.
and cost-wise for a patient, it's a great investment because they don't have to keep repeating the same injections.
Right. This is great. So on average, how many patients come here for Artifill versus the other products?
I'm going to say 90% is
Yeah.
permanent filler.
Wow.
But I gotta say, it's the injector. He is fantastic at what he does. Our results are beautiful, and the patients are happy. Most of all, that's what we want to see.
Well, our feedback has been so good that the company has then selected me to be a national trainer for Artefill.
Yes.
So other physicians come to our office now to be trained. Last week we had a young doctor here, and we did 4 patients and helped to train her on the use of Artefill. They don't do any injecting, they just observe. I do the injecting with Glori.
Have you always been in this industry? Is this your specialty, doctor?
No, I'm a former anesthesiologist. That's why I'm pretty
Uh-huh.
good with needles.
I was gonna
In pain.
And that's why I don't like, I'm very anti-pain. It was part of my heritage and training.
Yes.
I try to make the patients as comfortable as possible. We have had patients who have come here from other offices for procedures like lip enhancement, and said, "Doctor, it was so painful. I haven't done it in 4 or 5 years." But we do nerve blocks and make areas numb
Absolutely.
so that the patient's very comfortable. And also, if you're creating a face, I don't see how you can work if the patient's jumping around in pain. So we like to keep everybody comfortable.
Got it. So what are some of the side effects that you have seen from using this product?
I've seen.
Because that's always a big concern. of
Absolutely,
people.
and I've seen really bad results, but from someone that doesn't know how to inject the product. That's why I can't say enough. You have to go to a good injector. You have to go to an experienced injector. It has to be put at the right depth, at the right angle, and the right amounts. And this is what we do here at this office.
So my friends, what they're saying to you is, if you're going to do this, you need to find Dr. Melnick, because it's something, once you've put it in your face, how difficult is it to remove it?
Well, in our case, we've never had to remove anything because it's put right the first time. But
Right.
if there's any inflammation, there are counteracting steroids that we can use if there was some inflammation
Yeah.
associated.
And
And
let
one
me-
quick question,
yes.
and I don't want to forget to ask you this question, because this is something people will want to know. Do you do a spot test beforehand so a patient can know if this product is compatible with their bodies?
Absolutely. We do a
Okay.
skin test, and we have the patient wait 24 hours.
Okay.
And it's kind of like a TB test, just a little tiny dot under the skin. And if it's red, itchy, swollen, well, they're probably not a good candidate for this product.
Okay.
But for most time, we don't see any allergic reactions for the most part, I should
The
say.
reason why we don't have to take it out, remove it, because as Glori said, we usually begin to fill high up on the face
Okay.
very carefully, and then we have them return and see what's left. Because many times the symptoms of aging in the lower part of the face are really due to loss of volume in the upper part. So
Exactly.
once we've corrected that, you don't need much correction here. So we don't like to start on the lower part of the face.
Okay. And I know when I was working in this industry, which was about 10 years ago, doctors were afraid to put Botox and products like that around the mouth area. Is that still true?
No, we
No.
actually Botox the entire face. Again, it's a question of knowing the different nerves and the muscle actions
Right.
and where to put products.
So if a person is unhappy with something on their face and they can't afford to use the Artifill, then the Botox would be an alternative product, except in the end it costs you more.
Well, the thing is that Botox, a lot of times we're asking Botox to do so much. Like, I want my brow lifted, I want this done. It's just a little Botox. It's a little muscle. What do you call it, doctor? It's just going to reduce that muscle activity, and you're asking it to do so much. Our patients would rather do one Artifill than 20 temporary fillers.
Well, long term, it's
Long
most cost
term,
effective,
because
right?
you can even lift the eye area.
I
that
can
you
use
wanted.
the Botox to do a brow lift, as we call it. But we can use Artefill to do a brow lift that's almost like having eyelid surgery
And keep it there.
and keep it there.
Mm-hmm.
Okay, well, I thank you so much, Glori. I'm going to let you
thank you.
go, and hopefully that, you've really informed people who weren't sure about this product and that they will be coming in
Great.
to
Thank you
fix
for
what they
coming.
don't
Thank you
like.
very much.
Thank you.